Our next speaker is Zerbe. Ms. Zerbe was appointed by Governor Whitmore to be the executive director of the Michigan Veterans Facility Authority, which is the governing board for the Michigan Veterans Home. She's been in that position since September of 2019, and she is involved in the oversight and future operations of all the new state veterans homes, as well as directing the day-to-day duties of the MVFA staff. Prior to joining the MVFA, she was Vice President of Business Affairs for the Michigan Veterans Health System, and she oversaw the business offices of Michigan's two state veterans skilled nursing facilities. In terms of education, she has a multitude of degrees. She actually has a Bachelor of Arts in English and American Culture from the University of Michigan. She has a Juris Doctor from the University of Florida, and she also has a Master of Public Policy from the University of Michigan. And so now we'll let Ms. Zerbe talk to you about Michigan Veterans Homes.
Thanks so much, Jim, for having me today. My name is Zerbe. I'm from the Michigan Veteran Homes. Just here to provide a little overview of what we do. So thanks so much for having me. First of all, we'll talk a little bit about VA-covered long-term care, the State Veteran Home Program, Michigan Veteran Homes, a background about what we do, and some recent developments that we've had at the Michigan Veteran Homes, just to provide your audience with a little bit of details about what we're working on right now. So first of all, I just wanted to provide a little bit of an overview of what kinds of care the VA covers in terms of long-term care. There is a spectrum of care when you're looking at long-term care that many people are familiar with. It goes all the way from independent living to skilled nursing care that someone might need. The veteran homes across the entire nation provide certain types of care, but not all types of care. Some other types are provided by the VA. So, for example, assisted living has some availability for eligible veterans. Home care is available to some veterans who are enrolled in VA health care. Adult day health care is also available. And long-term care is sort of where we focus. It's available to all of the veterans that live in our state veteran homes. And it's available to priority status veterans in other settings that the VA addresses. Skilled nursing. Community living centers are one of the areas in which veterans can receive long-term care. They are typically located within a VA medical facility, and there are a limited number of beds. Community nursing homes are also available to veterans to receive skilled nursing care. Those are going to be private or nonprofit nursing homes that have a contract with the VA, and those homes will provide a certain number of beds to veterans. We are the last kind of tier in that skilled nursing facility provision. State veteran homes are long-term care facilities that are owned and operated by the states in partnership with the VA. And we are able to provide care to all eligible veterans regardless of the priority status within the VA system. So a little bit of background on the State Veterans Home Program more generally. A lot of times people get state veteran homes and the VA confused. We are not part of the VA system. We are instead a part of a partnership with the VA. We are regulated by both federal and state laws, but we are owned and operated by the state. So it's not going to be, although we operate in conjunction with some of the VA medical centers, a lot of our residents go to appointments there. We are not part of the VA, the federal VA system. So the state owns the building and the land. The program oversight, so our surveys and things of that nature, are performed by the USDVA and their contractors. We have annual quality of care surveys that are performed by them, and we are then recognized and licensed to act as a state veteran home by the VA. State veteran homes actually represent one of the largest systems of long-term care providers in the United States. Every single state in the United States has one, including Puerto Rico. We have over 30,000 beds for veterans and dependents that need skilled nursing care, domiciliary care, which we'll talk a little bit about, and adult day health care. So you can kind of see where all these veteran homes are all over the country. And it provides a tremendous number of beds, a tremendous amount of support, and just helps support the VA in providing that skilled nursing and other long-term care services to veterans that the VA is unable to provide in some of their medical centers. So skilled nursing care is going to be accommodations for individuals who are not acutely ill and not in need of hospital care. This is going to be what you think of as skilled nursing care, nursing homes, that type of care where someone's going to be staying either short or long term that needs that support in a residential setting. Domiciliary care is treated a little differently depending on the state that you're in, but it's going to be something less than skilled nursing care. Sometimes it's treated more like assisted living, it can be somewhere between independent and assisted, usually assisted living, and sometimes it is more a housing support program. So it really depends on the state, and we have a mixture of individuals who have participated in our domiciliary program in Michigan. Adult day healthcare is not something that we currently provide in Michigan, although we are looking into it, and it is our hope that we'll be able to provide that at some of our facilities moving forward. That would be where the veteran does live at home, either with family or someone else, but receives care during the day, maybe while their caretaker is at work, something of that nature. So recent developments and trends. So the VA has been continuing to increase its support of state veteran homes in large part because we really help support their capacity. You can kind of see on the chart, the number of homes has gone up steadily since 2000. It's actually even higher than this at this point. We actually, and we'll talk about it a little bit later in the presentation, have 2 new facilities under construction currently that are going to be providing these services to veterans in Michigan and their dependents. So you can kind of see the VA has really put a focus on increasing their support of this program and increasing the number of veteran homes across the country. So how exactly does this work? State veteran homes are eligible as part of that state-federal partnership to receive a per diem reimbursement that the VA pays, and it goes directly towards the cost of care of the individual, the veteran living in the state veteran home. So this is usually divided up based on what your service-connected disability rating is. And that's going to dictate how much the VA contributes towards that cost of care. So a veteran with a combined service-connected disability rating of 70% or more is going to be fully covered by the VA. That means when they come to the state veteran home, they do not pay anything out of pocket. And unlike some other options in the private sector where you would be required to spend money in order to receive care for free, spend down your assets, things of that nature, that has nothing to do with it. Simply the fact that you're 70 to 100% service connected is going to make you eligible to receive completely covered care, free care at one of our facilities. All other veterans are going to be partially covered by the VA, and we'll talk a little bit about those rates a little bit later on in the presentation. A little background about the Michigan veteran homes more generally. We have gone through a few changes in the last couple of years in terms of our organization, but essentially what our mission is just to provide nation-leading long-term care and services to the veterans that we serve in our facilities. We really want to continue to see improvements in our facilities and be one of the nation-leading providers. And I think we're moving in the right direction with the construction of some of the new facilities that we're building, and just very excited about some of those. And again, we'll touch on some of that as we move along. Grand Rapids, as background, we have 2 facilities currently, one in Grand Rapids and one in Marquette. The Grand Rapids home has been open since 1886. It's on quite a large campus with 3 main buildings and a large veteran cemetery that is also part of that campus. We're in the middle of a decrease in our census at that facility in preparation for opening our new building. So we have about 180 skilled nursing beds currently and around 20 domiciliary beds available. Jacobetti, located in Marquette, is in an older building that used to be a hospital and was first opened as a state veteran home in the early 80s. So we do have about 184 beds available at that location for veterans in need of skilled nursing, as well as some eligible dependents. In order to be eligible for care, a veteran must be deemed eligible for VA health care, for long-term VA health care or financial assistance for long-term nursing or daycare. We, subject to space requirements, do allow eligible dependents to live in our facilities. And a question a lot of times we had asked, is Michigan residency a requirement? You're not required to be a Michigan resident at the time of your application. So we have some folks who have lived in other states for a while, want to move back to Michigan to be closer to their family, and choose to live in one of our facilities at that time. So that's something that's definitely an option. The member cost of care is going to be based on the member's ability to pay. We do a monthly assessment that determines that. So it can range anywhere from zero to the full cost of care. We're going to consider assets, income, many of the same things that would be considered when someone is receiving care in a typical nursing home in the private sector. So residents that are unable to pay the maximum amounts are assessed on that sliding scale. Here is a breakdown of the exact costs for admission into the home and the monthly fees. So a 700% veteran, as we've talked about earlier, is fully covered by the VA. There would be no out-of-pocket costs associated with that. All other veterans, the current charge is $170.64 a day. And we'll talk a little bit more of what that equals out to on the next slide. Non-veterans also eligible to come to the facility and live are at $283 a day, and that's going to be for skilled nursing care. Domiciliary rates are also listed here. There's relatively limited number of beds, and it tends not to be what most people are most interested in when we have these presentations. So I'm going to kind of focus on the skilled nursing aspect. And this, you're looking at it on paper. What does that mean in terms of comparing when you're getting skilled nursing care out at some other nursing home in the community? Well, right now, you can kind of see on this slide what the benefit is to veterans coming and living in our facility from a financial perspective, which is right now for skilled nursing care, the average cost of Michigan is about $8,300 to upwards of $9,000 a month for different types of rooms, semi-private or private. And that's going to be over $100,000 annually to receive skilled nursing care. In the veteran homes, it's either going to be, no cost because you're 70-100%, or it can range anywhere, again, on a sliding scale from $0 to $62,000 annually. When you kind of spread it out over the year, you can see what a huge advantage this can be in terms of not having to spend quite so much on the skilled nursing care that an individual might need. So some of the recent developments we've had in the Michigan veteran homes, starting in 2016, we had a work group that was formed, included industry professionals, healthcare specifically, veteran advocates, and legislators to develop some recommendations about how we wanted to improve our system going forward. They shared its report, and a number of legislative initiatives and other things were developed as a result of that, which resulted in some funding and some legislative and statutory changes. The recommendations included the development of an authority-based governance model. We're not going to get too much into that because it's a little bit in the weeds, but it has a lot to do with the flexibility and adding some people to the board who had healthcare experience. It also recommended the new construction and operation of some smaller facilities. Right now, we have very large, much more institutional facilities. They look a lot more like a traditional hospital. Now we are talking a bit more about facilities that look more like home-like environments. And the recommendation was to spread those smaller facilities out in population centers across Michigan so that more people would have access. You can see on this slide that we used to run in Grand Rapids a facility with over 600 beds. That is a very, very large skilled nursing facility. So now this is a little outdated. We are actually down to 180 instead of 320. We're running a smaller facility. And this is, you can kind of see when you look at this map, there's very little access in certain areas of the state to receive this skilled nursing care unless you want to drive to Marquette or Grand Rapids. So the discussion was, how do we use these 964 beds that we're currently eligible for to spread that out across the state? And so we asked the VA to do a bed replacement project where we would look at different population centers and spread those eligible beds out from just those 2 locations to be spread out across the state. It's a multi-phase plan, and we want the model of it to be replicable, where we can, once we build one, we have something else that looks similar that we can use those plans to design and build other facilities in different locations. They'd be designed to better align with a lot of current industry standards, which is going to be less hospital-like, more home-like. And we'll talk a little bit more about that as we move through this. We'd also recommended the geographic distribution, which we talked a lot about. And we wanted to build something that is much more desirable for people to live in moving forward. We know that today's veterans don't want to necessarily live in a room with 2-3 other people, which was how the design of the original Grand Rapids building was. Sometimes we had rooms where four veterans were living together in a room. People just don't want that today. So we wanted to look at how do we provide semi-private or private rooms to all of our residents. So right now we are in phase 1 of our replacement project, where we are replacing the Grand Rapids facility with a smaller facility. And again, these numbers are slightly outdated based on our new design. We are actually going to have 128 beds in each of those facilities. And the location has been decided. It's actually in Macomb County in Chesterfield Township. So a lot of this has happened in the last year, where we received federal funding, we've started construction, and we are scheduled to complete a lot of that construction in 2021. So a big part of this is a small house design, which is going to be about creating a home-like environment. That is one of the main goals of this design. We talk a little bit here. It's a design that's recommended by the VA. They've really encouraged it as part of this grant program that has helped fund our construction of these facilities. So what the basic concept would be is you have a community center surrounded by smaller home-like units that are separate. They're like a household instead of more like a hospital wing, which is what you tend to see in older designs of skilled nursing facilities. This just gives you a little idea of what you would want it to look like. The community center is going to be that hub for all of the households that surround it, where you're going to have your multi-purpose room and your bistro and things of that nature. It really feels sort of like the town center. It's intended to create a sense of family among residents and staff and provide opportunities for more engagement in small groups, in a sense of, this is really my home, this is my residence. It doesn't feel so institutional. It feels much more like a place that you want to go live. So these are some of the architectural impressions we have of the design that's currently underway. You're going to kind of see, this would be an example of a household where you have access to the outdoors. This is really going to help. I mean, this isn't part of the presentation, but in light of everything that's going on with COVID-19 right now, we know that having this single-story design is going to help us facilitate keeping up a lot of social interaction, getting outdoors for our members when you do have some type of infection control crisis like the one that we're facing right now. This is a kind of example of the indoor architectural impression of an area that would be the dining and living room space out in one of our neighborhoods. So this is where people live. As you can see, much more home-like design. And this is an example of a resident room. All the resident rooms in the new facilities are going to be private rooms. So we will not have any more shared rooms in the new facilities that we're building. A lot more space, a lot more opportunity for natural light. Those kinds of things are really important in this type of setting. So if you do have any desire to contact the homes, this is some contact information for you to be able to do so if you want to inquire about admissions or any of the other things that we're working on at the homes. But this was just to provide you with a high-level overview of what we're doing, what we have been doing, what we are doing now to move forward. And I really appreciate everyone providing me with the time today to present and give you a little more information about what we're doing at the Michigan Veteran Homes. Thanks so much.